My name is David Tart, and I'm the Southern Regional Director for Trillium Health Resources. Thanks very much for coming out on kind of a rainy day. We are very excited at Trillium to be engaging in this new partnership with Columbus County and bringing what we do to your community. And I'm privileged to be joined today by a number of team leads within Trillium. And trust me when I tell you, you're going to be, you're much more going to want to hear from them than you do from me. So, but I did want to start out by giving at least a few words about Trillium in general. And just if I step away from the microphone, can I still be heard? Yeah? Okay. Because I'd like to be able to see what's on the screen and make sure we're all on the same page. Okay. So, first of all, what is Trillium? Trillium, as you can see on the first slide, is a local management entity managed care organization, and we frequently abbreviate that as LME-MCO, responsible for fiscal management of mental health, substance use, and intellectual and other developmental disability services in Eastern North Carolina. So is everyone clear now on what we are? No, I'm just kidding. I know it's confusing. So at the risk of overcomplicating, I'll try to simplify. So basically, we're responsible for, with Columbus County now, for 26 of the easternmost counties in North Carolina. And we're responsible for services for these populations: mental health, substance use, and IDD. And we're responsible largely for people who are either covered by Medicaid or people who are without insurance altogether. People who are without insurance and can't afford insurance. So what we don't do, and this is where it gets a little complicated because we are a function of local government. We're a local governmental agency, but we don't provide direct care in the same way a Department of Social Services or a health department would do. Instead, we have agreements and contracts with private providers. We have over 400 providers in our network who actually provide the services, and then they bill us for the services that they render, like most simply perhaps psychiatry and therapy, and then we reimburse them for the services they provide in the same way perhaps your insurance company would reimburse a provider, your doctor or your dentist if you got care. And our mission is transforming the lives of people in need by providing them with ready access to quality care. So why are we here in Columbus County? The short answer is that we're here because you guys asked us to come. In January of 2017, your county commissioners voted to disengage from East Point, which is the entity that currently manages care here, and move over to management under Trillium. And as you can see in the first bullet point, the authority for approving that decision under North Carolina General Statute lies with the Secretary of the Department of Health and Human Services, which is currently Dr. Mandy Cohen. So pretty quickly after Columbus County made the decision, Trillium, our board met, our governing board met, and voted to accept. And around the same time, in February of 17, the state came up with a new list of rules for disengagement. So Columbus County was the first county that had to comply with this list of rules in order to disengage, which is why this has taken more than a year to happen. But Columbus County did their due diligence, did everything the way they were supposed to do it, and on March 21st of this year, the Secretary agreed that they were in compliance with the rules and agreed to allow Columbus to disengage and come over to be managed by Trillium. And gave us the date of July 1st to be ready to do that. So not much time. They asked us by April 15th for a plan, to submit a plan to the state for how we were going to be able to do this without disrupting care for individuals or disrupting processes for providers. They want, and we want this to be, cause the least disruption possible, particularly for the people who are currently receiving services in Columbus County. And I should say that we continue to meet with the state on a regular basis. We continue to meet internally on a regular basis to ensure that we're moving along with the plan as intended. So a little bit more about who we are. With Columbus County, we will be managing 26 counties, stretching from Virginia to South Carolina. You can see this is what it looks like. We're the largest of the LME MCOs in North Carolina, the largest of the managed care organizations in terms of numbers of counties served. The total population of our area with the addition of Columbus will be almost 1.5 million, approximately 266,000 individuals who are covered by Medicaid or eligible for Medicaid. So that gives us 13% of the statewide Medicaid enrollees and 15% of its total population. Geographically, we cover almost 13,000 square miles, which is larger than the state of Maryland and 8 other states. And perhaps interestingly, we have a widely varying population density. With Wilmington and Greenville, we have the 8th and 10th largest cities in the state, but most of our catchment area is very rural. And in fact, our area includes the 2 least populated counties in North Carolina, in Hyde and Tyrrell County. I showed you this map before, and it emphasizes our regional model, so I'll show it again. Perhaps you would guess this, but of course Columbus is going to be part of our southern region. And with the addition of Columbus County, you'll see that the population of our region is 714,000, which makes us, population-wise, the largest of the regions. Number of counties-wise, the smallest of the regions. I wanted to give you guys some statistics. So the last complete year of data we had was for fiscal year 2017. And that year we were serving 24 counties. And we served nearly 53,000 people. Got a billable service through Trillium in fiscal year 17. 81% had mental health diagnosis. 21% a substance use disorder diagnosis, 11% an intellectual or other developmental disability. Now, you may look at that and say, hey, David, those numbers don't add up to 100%. And you'd be right. And perhaps it's obvious, but if not, it's because although nearly 53,000 unique individuals were served, they didn't kind of neatly fall into these categories. Many people have diagnoses in 2 or even 3 of these areas. So that's why they don't add up to 100%. But at the end of the day, the amount expended on services in the 24 counties that year was over $355 million. And again, we do that through our network of providers, which is well over 400 strong. Now, I may or may not have mentioned this a minute ago when I showed the regions, but when Coastal Care, which was serving the southern region, and ECBH came together in 2015, ECBH having been serving the northern regions, we came up with a regional model. And there are several reasons for that, but one of the main reasons is to ensure that all of the counties are represented in our governance. So how we do that is each of our regions has an advisory board. And the advisory board is comprised mostly by individuals selected by county leadership. So each of our counties appoints 2 people to our regional advisory board, and that will be the same here in Columbus County. Your commissioners will be asked to send one of their own, a commissioner, to serve on our regional advisory board, and another individual as well, who falls into one of the categories outlined in general statute for qualified individuals. For example, they may send someone with expertise in healthcare, business, law, several different categories that are dictated by statute. But that's entirely at their discretion who will serve. Additionally, the chair of our regional CFAC is part of our regional advisory board. CFAC is Consumer and Family Advisory Committee. Now, this is something that's very important to us, and I'll talk more about CFAC in a minute. But first, the duties of the Regional Advisory Board, monitoring performance at the regional level, identifying gaps and needs in services so that Trillium can make more informed decisions about where we want to expand our network, maintaining relationships with our counties, our communities, other key stakeholders. Participates in evaluation of the regional directors, which means they evaluate me and my job performance. Recommend priorities for use of state and county funds. Each county contributes a small amount to our budget each year, so they have input into how those funds should be expended. Monitor the resolution of issues, and then importantly, they're responsible for appointing members, representatives to our governing board. And so this is where CFAC really figures in most meaningfully, I think, into our system. So well, first of all, our Consumer and Family Advisory Committees they're three, one for each region. They are independent, they function independently of the organization. We don't govern what they do, but they exist to advise us on a variety of issues also dictated by general statute. And in addition to the chair's service on our regional boards, sorry. There we go. Each of the CFAC chairs, each of the three CFAC chairs also serves on our governing board. So we have 12 voting members on our governing board, and we're extremely proud that a full 1/4, 3 of the 12 people who are on our governing board are either people who are served by Trillium or people who are a family member of someone served by Trillium. And I believe that that's not a claim that any of the other LME MCOs across the state can make. And it's something that not only we're very proud of, but something that serves us very well. So the other 9 members are selected by the regional advisory boards. That's, so doing the math, that's 3 per region. And the groups send 1 county commissioner to the governing board, and then 2 of the other individuals who meet the criteria defined in statute that I mentioned earlier. We have 1 non-voting member that represents our provider network. So if there are providers in the room, the chair of the network council that represents you all also attends the governing board meetings but does not vote. Duties of the governing board are defined by statute, but determining policy and strategic planning, really to have oversight over everything that we do, overall performance and finance, governmental affairs, and then responding to the concerns that the regional boards bring up to them. They meet every other month. Regional boards, this may or may not be interesting, but how it works is the regional boards meet 1 month, and then the governing boards the next. So each board meets 6 times a year. Internally, we employ 440 individuals currently, led by our executive team comprised of our CEO, Lisa Wainwright, her vice presidents, medical leadership, legal leadership, and in turn, they then manage 18 departments, many of whom you'll hear from here today once you get me to shut up. We have office locations in the north, Hosky and Camden, in the central region in Greenville, and in the southern region in Jacksonville and Wilmington. We have employees in all the counties, so having a number of offices across our area allows people to have ready access to the resources they need to do their jobs. And we're also, I'm happy to report, looking at office space in Whiteville right now, so we'll be able to add additional office capacity for our staff. And finally, before I turn it over to everyone else, I wanted to just talk about our system of care. Each county, and Columbus will be no different, is assigned a system of care coordinator, and this person is largely responsible for relationships with the agencies in Columbus County. They serve as in an advisory capacity to the Community Collaborative, which is also an independently functioning group. We have a SOC that's assigned to our CFAC, which I mentioned earlier, and they provide technical assistance to the agencies and serve on in the needed capacities for the groups that are run by local DSS, juvenile justice, such as juvenile crime prevention, child fatality review teams, and that sort of thing. So if it's something that you have interest in, either the collaborative or CFAC, I encourage you to contact me. Do we have the Columbus email posted anywhere?
Yes,
Is it out there?
at the end of my presentation we'll have it.
Okay. Well, we have a special email for Columbus County, and you can reach me that way. Again, my name is David Tart, like a Pop-Tart. Hopefully that'll help you remember. And if you forget, the regional connections section of our website, is that what it's called?
Regional Connections.
Regional Connections, I got it right. The Southern region, my email is posted there. I encourage anyone to contact me directly if you're interested in either participating in the community collaborative that will be occurring here or our CFAC. I was able to talk to Mr. Russ yesterday, who's been your sole representative on CFAC for East Point, and we're in agreement that he could use some help. So anyone who's a consumer, knows a consumer of services, or one of their family members, please encourage them to come to one of our CFAC meetings. We would love to have additional representation from Columbus County. So I'm going to hand it off to the people who are here that do the meaningful work every day and that you're going to want to hear from. But I did want to give everyone an opportunity to ask any questions you have of me, and you'll also have an opportunity to ask questions at the end of each of the presentations today.
Again, as he so kindly introduced, I'm Ashley Ray. I'm the Access and Care Coordination Manager in the call center with our Trillium Connections department. It's encompassed by our Housing, Network Development, and Call Center. We kind of think of ourselves as the front line of the organization. I can't see. Am I good?
No, other way.
Other way?
Yeah. There you go.
There we go. Thank you. Bear with me. Today I want to talk to you about a couple of important topics when it comes to call center, customer services. Our staff, the two lines that we operate on a daily basis, our business line and access to care line. Our philosophy for no wrong door in terms of accessing services. Referrals to care coordination and our care coordination that we do in the call center, along with the registry of unmet needs and crisis services. I have a slide just to show you a little bit of what we're made of in the call center and customer service department. We are overseen by our senior director. There are two managers, including myself in the call center. I'm over our access clinicians and access coordinators that provide the short-term care coordination. And then my peer, the customer service manager, is over the agents and coordinators that provide day-to-day technical support, take complaints and concerns, and offer resources. Did I go the right direction?
Mm-hmm. Incoming calls.
Okay. Incoming calls to Trillium Connections. In terms of our business line, that 866-998-2597 number, we encourage people to use that line for day-to-day business, to contact Trillium staff internally, to lodge complaints and grievances, and if you need just any type of information or assistance, technical assistance. We really encourage individuals to use the Access to Care line when you're trying to get specifically linked to a service, especially a crisis service. And that line is 24/7, 365. So Monday through Sunday. That's that 877-685-2415. In terms of accessing services, that no wrong door philosophy that I mentioned just a few minutes ago, with Trillium, we want you to feel comfortable accessing services any route you want, whether that is contacting us directly in the call center, well, we will assess the urgency of your need and then link you with a provider closest to you in your community, or go to that provider directly if you so choose. We don't want you to feel like a hindrance to have to contact us. We are there to help you and assist you, but you do not have to go through our call center or through Trillium to access the care that you need. It's also important that the providers in our network understand that if they can't provide the service that you're seeking, if they assess what the urgency of your need is, then that they will then refer you if they cannot provide the service to a provider that does. Individuals may contact the provider directly to schedule an appointment, as I was just mentioning. Some providers offer same-day access or the opportunity to walk in. And then again, you can contact us and we will get you linked with an appointment that same day that you call in. Depending on the urgency of need, we'll get it scheduled within 14 days, within 2 days, 48 hours, or within 2 hours if you're experiencing an emergency. So, how can someone find information on providers, services, and resources? Just want to let you know that you can always contact our call center. You can go online to our website. There we have access to our member handbook, general information, and the provider directory, where you can find a provider by typing in your zip code or county. We also encourage members and families and stakeholders to utilize social media outlets, including Facebook. And we also support a resource database called NC211, who's partially supported by the United Way, and they're comprised of all the resources in our local counties, and we encourage our members and families to utilize them for things like food bank information, housing information, that kind of thing. We also provide printed material, newsletters, interviews on TV, radio, newspaper, and of course word of mouth. Now, when you call our business or access line, I want you to know a little bit about what to expect. Some people see it as a nuisance. We see it as an important part of doing our job. When you call in, we're going to ask for your name and number and the nature of the call. It's really important that we find out right away if you are experiencing an emergency or a crisis. And that's one of the reasons we ask those questions, because if for some reason we get disconnected, then we'll have a way of returning that call back to you. We'll also ask you, what county you're calling from, so we know where to narrow down the resources that we need to link you to. For those individuals seeking services, we're going to gather some basic demographic information. We're going to ask you name, date of birth, your address, verifying that type of information. And then we may ask questions associated with certain type of funding sources, benefit plan type information, so that we can make sure we link you to the right service at the right time. Our clinicians are trained to ask specific screening, triage, and referral questions. As I mentioned briefly a minute ago, it's a short telephonic screening to make sure that we get you, your family member, community member, linked to the service they need at the right time. So if it's an emergency, we're going to get you linked within 2 hours. If it's urgent, within 48 hours. And if it's routine, then we're going to look for an appointment within 14 days. So a little bit about care coordination in the call center. We have coordinators and clinicians that perform short-term care coordination for members not already assigned to care coordination. We can certainly make referrals for more long-term care coordination, but our team is pretty skilled and cross-trained in both mental health, substance use, and intellectual developmental disability needs and services, that we get together on a daily basis to staff cases, calls that come in, to provide the support and resources that individuals calling in. So we do provide that on a short-term basis. We also work very closely with every county department of social services, all the local hospitals, and state hospitals. In the call center, we ask a lot of questions. It helps us better understand the experiences and needs of our members and their families. We're charged with connecting individuals to the most effectively, clinically appropriate services. And besides services, we connect callers with other possible resources in the community. So in the call center, we'll really strive to, it's going to be our goal to really strive to learn Columbus County and know all the resources here. So if there is something that we can't link you to that is covered by a Medicaid service or a state-funded service, then perhaps it's something that can meet your needs in the community that we know about. We also manage the Registry of Unmet Needs. It's for the Innovations Waiver funding that is there to support individuals with intellectual and developmental disability needs. We have one coordinator in the call center that is kind of her role to man that registry, but any coordinator or clinician in the call center can answer questions about the Registry of Unmet Needs. families must apply for the innovations through a written application process to include the most recent psychological evaluation. The application can be obtained by calling into our call center, and we can mail it to you. You ask to speak to a coordinator clinician, and we'll get that application sent on to you. The Registry of Unmet Needs Committee reviews applications monthly, just so you know. And in addition to reviewing requests for innovations, call center staff and committee members will share information on possible resources, services, and supports whenever possible, understanding that even if an individual is placed on the innovations wait list, we have no way of knowing just how long that person may be on the wait list. New Innovations Waiver funding is allocated by the state. So Innovations Waiver funding will be distributed on a first-come, first-served basis under your date of waiting and other variables determined by the state. Mobile crisis in Columbus County, I'm happy to say, will be provided by Integrated Family Services. They have offices located all across our catchment, and they also have another online neat feature called Crisis Chat for emotional online support, and we have someone here today that will talk to you more about the mobile crisis services they have to offer. And in hopes that I've kept up with the slide and what I'm saying to you, I'm on the last slide just to let you know my contact information. My colleague, Myra Felton, who's the other customer service manager, our director, Christy Edwards, and her email address, and just encourage you to contact us at our administrative business line. If you have any questions or concerns, we'd be happy to try to address them any way we can.
Good morning, everyone. My name is Holly Cunningham, and I am one of the child care coordination managers in our mental health and substance use care coordination department. We serve both children and adults in our department, so I'm here to talk a little bit more with you about what is care coordination at Trillium. And I'm on the right slide. All right, so what is care coordination? Our mental health substance use care coordination is the clinical oversight to certain members receiving mental health and substance use services in our Trillium catchment area. Our clinical care coordinators seek to link our members to the most effective and clinically appropriate services that will assist the members in achieving their wellness and maintaining their wellness and meeting their needs. Okay, so what is care coordination? As I mentioned before, care coordination is available to both children and adults, and it's typically for those children and adults that are hospitalized, that go to an emergency department, or for our children and adolescents, if a provider or a family member or a guardian is specifically requesting some type of out-of-home residential placement for the child. So that's typically the group of members that we're providing care coordination for. Care coordination is also person-centered to meet the members' preferences and needs, and we really work hard to integrate both behavioral health and physical health or primary health care services as we are providing care coordination services. Our care coordination examines and helps link members to both paid support services and natural and community supports. We feel that's really important. And our care coordination also ensures the development of a comprehensive plan and a crisis plan. And we monitor those services to make sure that the services that are on that person-centered plan are being provided to the member. Okay, so care coordination is a function of the LME or the MCO. And I'm going to go into a little bit more detail about each one of these. But our care coordinator, for every member that we provide care coordination to, we are ensuring that the providers are completing assessments, person-centered plans, and crisis plans. And our care coordinators are providing linkage to needed services. We're educating about a variety of different topics, communicating with that member, perhaps their family and the community, and we're providing monitoring of the specific services that they receive. Okay, so assessments. So As David had mentioned earlier, we don't provide direct services, so all of our providers are the folks who are doing the assessments. So all of our assessments are completed by the providers with the members, and from those assessments, we end up with clinical recommendations for specific services that the member might need. So once we get that assessment, or the care coordinator will get that assessment, they review that assessment that's been done with the member, and we use that to help link the member to the services that they need. Clinical care coordinator can also recommend further assessments if they think that might be needed. So we might recommend a psychological evaluation, we might recommend some type of assessment for trauma history or substance use or any other specific need that the member might have. Okay, so for treatment planning, what the care coordinator will do with the treatment planning, all of our care coordinators are involved in either child and family treatment team meetings, or they may also be involved in a discharge planning meeting if the individual is in an acute hospital. For treatment planning, our care coordinators also assist with the development of the person-centered plan and the crisis plan. We recommend goals and interventions and help monitor that plan. We also recommend evidence-based services that might assist the member in maintaining their wellness and meeting their treatment goals. So, for example, if we have a child that has experienced a trauma history, we might help link that member to an evidence-based practice such as trauma-focused CBT or parent-child interaction therapy, or a number of evidence-based practices that we might try to link them to. We also coordinate services and supports among multiple provider and service agencies. So we have that communication with our member, and we try to coordinate all of those services and help the member to coordinate those services amongst all of those members. That can also include family doctors, primary care, maybe an occupational therapist, someone at the school, whoever is providing services and that member wants to have on their team. Okay, our care coordinator works with the member being served and their family, and these are some of the things that they might link them to. We might link them to additional mental health or substance use services and the provider agencies that provide those services. We also link them to physical health services, so they might need to see a dentist or a dental practitioner, or it's a child that might need speech therapy, so we link to those services as well. We also work really hard to help members find community resources. So we might help them find a food bank, a church they might want to go to. We might help them with housing services, get them linked with the Department of Social Services for any service that they might need, or transportation, or wellness cities. We also link to advocacy groups and support groups, so we'll share information about how to get involved with NAMI, or if they're looking for an AA group or an NA group, we'll help provide that information as well. And also with natural support. So again, linking them with churches, or maybe they want their child in Boy Scouts or Girl Scouts, or a summer camp, or with Parks and Rec. Those are just some examples of some natural and community supports. Okay, in terms of education and communication, we provide a lot of education in a number of ways. We might be providing education if a member has a new diagnosis. They go for an assessment with the provider, and now they have a new diagnosis and they don't quite understand what that means, or need to have a conversation about the symptoms related to that and what services they might need in order to address that diagnosis or those specific symptoms. We might also educate on primary health care services that they might need to meet their physical health needs. And also, again, about self-advocacy regarding their treatment and their service needs. Okay, our care coordinators, also for the duration of the time that we're providing that care coordination services, we're monitoring a number of things. We're monitoring and ensuring for the member that the recommended services that are indicated on their person-centered plan are being provided. and that those services are being provided to the satisfaction of the member. We're also working with that member and the provider, so if the services that are being provided to them are not to their satisfaction or not specifically meeting their needs, that we're working with the team to make sure that we get that person centered plan right, we get the supports and the services and the interventions that are needed for that member. Okay. All right, we also, as I mentioned before, we have an out-of-home process for youth. So again, if we have a family member or a guardian or a provider that is seeking or requesting some type of out-of-home residential placement for a child, we have a specific process within our child care coordination department, and we call it our out-of-home process. And it requires that you complete an out-of-home form for us, or a request form, which can be found on our Trillium Health Resources website. If you go to that website under providers, you'll see there's a form for the out-of-home placement request and some additional information that needs to be submitted. So we typically need an updated comprehensive clinical assessment that's recommending the specific level of care that whoever is making that request, so we know what level of care is being requested. We might need a child's IEP or a psychological evaluation or other additional information to help get that child linked to the appropriate service. All of those requests are assigned to a care coordinator. So in this case, a child might not go to an acute hospital, but the family, the provider is requesting that type of out-of-home placement. So a care coordinator would get involved at that time to begin having those conversations about what the next steps are. Okay, got a few more slides. I think I mentioned before, care coordinators participate in child and family team meetings with youth and parents for all of the children that we're care coordinating. We also work really hard with any barriers or roadblocks for keeping appointments or transportation to get to appointments. We also talk with members about any questions or concerns that they have about their treatment and try to help them get those addressed, whatever those might be. And our care coordination with members is primarily telephonic. Okay, so for if there are any providers in the audience, this is what our care coordinators need from you. We need providers to notify care coordinators of any changes, any incidences, any crises, anything of significance that's related to the member. So that's really helpful for us in providing that continuity of care to the members that we're care coordinating. We also need providers to help us ensure that members are appropriately linked to primary health care, because we know that is a really important piece of the continuity of care and the services that they're receiving. Also, it's really important for providers to also help us with referrals to natural and community supports. And we need providers to follow up whenever a member that's considered at high risk misses an urgent or emergent appointment, and to contact the care coordinator working with the member if they've missed 2 or more appointments, so we can really, again, help to address those barriers to either transportation or, getting that appointment rescheduled, because we know that's really important. Okay, so did I land on the last slide? Okay, great. Okay, so again, I'm Holly. Rob Heigl is also our other child care coordinator. I'm in the Wilmington area, and Rob's in the Greenville area, so we're kind of split that way. We also have 2 specific adult care coordinators, and those are Jennifer Cox and Tina Davis. We also have a complex care team, and Darlene Webb is our complex care director, so that team serves both children and adults. And then Jackie Beck is our transitions to community living director. So again, those are all of our emails, and you can please email, or if you have any questions that we don't end up answering here. So, okay.
So for IDD care coordination, intellectual and developmental disabilities, I will likely use the IDD to shorten it as we go through our conversation today. But what is care coordination? Care coordination is person-centered, is based on the person's needs, and of course, we're all very different. So one thing that you can count on is supports for the individual are going to be individualized to that person. Care coordination is assessment-based. There are some assessments that care coordinators complete, but the majority of assessments are completed by other professionals. Interdisciplinary team approach, so looking at who the person's team is and seeking contributions from that team is very important in terms of how we support folks who have intellectual and developmental disabilities. Planning, very, very important. So using all the information from the various sources to inform that person's plan. One of the most important things that we do is to facilitate those a person's team meeting to the degree that they want us to facilitate. When possible, we always encourage the individual, the member, and his or her family to take the lead in saying exactly what's important to that person. There's coordination of services and supports that's a big part of our care coordination. So whole person health. So not just focusing in on supports that may be more focused on the person's intellectual developmental disability, but physical health as well. So again, whole person. Monitoring services and supports is also a huge piece of the responsibility of IDD care coordinators. I'll talk a little bit more about monitoring a little later. So. Goals of care coordination. To support individuals to have a life that they choose. And we're looking across all the avenues that you and I would look at to have a full and meaningful life. So that's life, work, and the things that we do, leisure, or play. We also want to ensure individuals are referred to and appropriately engage with providers who meet their needs for mental health, intellectual and developmental disabilities, substance use, primary medical care, and any other specialty health care. I mentioned it a little bit earlier. Routine monitoring to ensure satisfaction with the services that they're receiving, making sure it still works for that person. We all often do what we refer to as ISP or individual service plan updates. So it's not in stone. A person has a plan and they can make changes to that. Integration of mental health, developmental disability, and substance use services in primary and specialty health care. And that really is that whole person care that I talked about a little bit earlier. So who is eligible for IDD care coordination? Is that the slide or
I
something?
think you went past it, probably.
So those folks who are receiving services through the Innovations Waiver are eligible for IDD care coordination. Folks who are living in an intermediate facility or IDD setting and need coordination to transition to services in the community are also eligible. Individuals residing in a facility operated by Department of Correction or Department of Juvenile Justice and Delinquency Prevention are also folks who would be eligible for IDD care coordination. So now I'm going to talk about IDD training. So there are 90 IDD care coordinators. They have a status of qualified professional. We deliver our care coordination based on specialty areas. So the care coordinators have particular expertise in one of these areas: autism, folks with intellectual developmental disability who also have a mental health or a mental illness diagnosis, young adults in transition, so folks who are transitioning to adulthood, children and adolescents, older adults, and folks with complex and medical kinds of needs, support needs. We have a senior director, who I mentioned earlier, Rose Burnett, 2 regional directors, myself, I am the IDD Care Coordinator Director for the Southern Region, and Juanita Murphy, who was in here just a few minutes ago, she's in the back of the room, is the Regional Director for the Northern and Central Region. The supports intensity scale, this is something that's been in place for a few years at this point. We have a manager who oversees our SIS work. There are six SIS evaluators. SIS, as you may or may not be aware of, is a standardized tool that's used throughout the state, so it's not just something that's used by Trillium, to identify members or individual support needs. So SIS will continue to be completed throughout the Trillium geographic area. A new SIS is completed for children every 2 years because they're growing and changing, and for adults every 3 years, and that will remain the same. I might master this by the time it's time for me to sit down, right? Okay, so who receives IDD care coordination? Currently, there are 1,700 people receiving services from Trillium, IDD care coordination services, IDD care coordination, and with adding Columbus, that would be 120 additional members. And please note, and I think in the earlier, when Ashley talked about the registry of unmet needs, the state is basically who determines who receives that funding. Transition for Columbus and Columbus for the Innovations Waiver members. So we will be assigning care coordinators to individuals based on the specialty areas that I mentioned and talked about a little bit earlier, where they live. We will be notifying individuals and parents and guardians regarding their assigned care coordinator very shortly in July. In some cases, if there's information that we still don't have, providers have been working with us to share information around current support plans, certain assessments that we need to have access to. But there may be instances where we still are gathering information, and we'll be in conversation with members or their legally responsible, the legally responsible person for that member. Effective July 1, we will actively be providing care coordination for individuals who receive Innovations Waiver services. Our goal, of course, is to make this as seamless of a transition as possible for the member. Services will just keep ticking along as they are identified in the person's current ISP or individual support plan. So let's stop there. And here's our contact information. Myself and my colleague, Juanita. So let me ask if you all have any questions for us.
Hello everyone, my name is Jennifer McKeith and I am the Communications and Marketing Director. And that is a little bit different when people think of marketing, they think of advertising, splashy TV commercials, that type of thing. And the primary function of the communications and marketing team is a little bit different. Our primary function is to get information needed by our members, our providers, family members, the agencies and community supports that we work with in all the 25, soon to be 26 counties that we serve. And to accomplish that, here's a whole long list of what we do to get that information out there. The first point of contact for most members is the new member letters that we mail out every single week. And we also recently sent out over 13,000 letters to the members that will be transitioning over from Columbus County as well. And these letters, we're required to include information in the letters that points the members to the information that they need to find, specifically our member handbook and copies of their rights and responsibilities. And we also mail letters like this out every year to remind you of where you can get that information. And we share a lot of that information on the website. I'll show a tour of our homepage a little bit later. to point out specifically where you can find a lot of this information. The member handbook, the rights and responsibilities, our provider directory is online, and educational opportunities and training. We have a calendar that shares not just Trillium information, but those community supports and agencies and partners I mentioned earlier. We also share information that they send to us as well. Now, all this information is located on the website, but our call center can assist with sending any of this information as a hard copy as well if they are contacted. We also work closely with the media in our catchment area, the weekly, daily printed publications, the television stations, radio stations. We have a media distribution list, so when I don't know if a lot of you get the News Reporter or the Taylor-Norris Tribune, we've been sending out weekly releases to them about some of the additional services that we're helping to launch in Columbus County after July 1st as well. We do also offer translations for any of the printed brochures materials that we have. We do have Spanish information available on hand. We work with an external vendor that can also translate into dozens and dozens of additional languages, and that does include Braille as well. The next two email addresses, the first one, the info@trilliummc.org, is available 24/7 for general questions. If you have an inquiry about specific information, where it's located, you can request printed materials through that avenue as well. If you're asking a specific question that maybe should be handled by a clinical team member or network, we can help forward it to the right contact too. And the next email address was referenced earlier, columbus@trilliummc.org. That is an email address we have set up specifically for this transition. So if you are a provider and have a specific question about the process, the contracting process, you can reach out to that. If you are a transitioning member, have a specific question about any changes to the process or anything else, you can reach out to that email address too, and it will be answered by the appropriate staff member. We do have social media accounts. I'll share some pages, examples of that later. That's another way that we share information. And again, that's broadly not just for Trillium. We share information from the state DHHS office, the various contacts that we follow. We're very open with how we share information on there too. We want it to be a true support and information outlet too for our members. Of course, printed brochures and flyers. We have some out on the table out front. If you do not pick up any when you arrive, please definitely grab some. We have our general accessing care brochure that has the 24-hour access to care line that Ashley mentioned, and also the business number for other inquiries. We have some information out there on our mental health first aid training, the crisis intervention team training. So lots of good material out there. So if you haven't picked some up, please do. And we do share those with our external partners, DSS, hospitals, other locations as well. We have external newsletters that we email out quarterly, and I'll show you where to sign up for that on our website too. That's another great way to get information about Trillium. And we also are actively involved with different events around the community. We do accept requests for event sponsorships, and there's also times where we're asked to come have an expo booth or an information booth at different events to get the information out there. We have, of course, learned with Columbus County, as with many rural areas, the internet can be an issue. So while we do share a lot of information on our website, we understand that sometimes we do have to come out there in person like we did today to get that information out there too. So if you haven't seen it enough, here's another image of our Trillium logo, so you'll start to become familiar with it as you see it on more information. And also our mission statement is transforming the lives of people in need by providing them with ready access to quality care. Still? Okay. Can I get back? Sorry, that looked like my first slide. So now I'm going to show a little tour of the homepage of the website where you can find a lot of this information that I referenced. We do have the Find a Provider, the online provider directory is linked to directly from the homepage. In addition to the Contact Us, our 24-hour access to Caroline is directly on the homepage as well. We do have a blog that shares some first-person experiences from some of the members and partners that we work with. So if you haven't had a chance to watch some of those videos, you definitely should. They're wonderful at sharing the impact that Trillium and the agencies that we work with have in the communities that we serve. We do also have blogs of some of the upcoming events, and I'll show you the area where you can sign up for the external newsletters too. And then we do have separate interior landing pages. We have a page just for our individuals and families where the the member handbook and the rights and responsibilities can be found as well. I believe someone already referenced some of the forms and information that can be located on the For Providers page. So we have a section that includes all of the forms and contacts and links and all the communication that we prepare for them too. And David mentioned earlier, we do have a regional connections page. As he explained, we're divided into 3 regions, the southern, central, and northern, and Columbus will be part of the southern region. We have some information on the community collaboratives, other ways for getting involved on a regional basis. Our Trillium initiatives are external entities that we work with or programs that we've helped launch. One example is the Child First program that we will be expanding to Columbus County as well. And then again, the news and events in the calendar. And the About Us page has a link to the pages we developed specifically for the Columbus County realignment. And again, we have separate pages just for members where we are sharing all of these info sessions and listening sessions. And then we have a separate page for providers as well. If you're a provider, you've probably been there already, that list out the separate forms that are involved with the process to be contracted with Trillium too. And one additional piece of information we have on the homepage that is temporarily off. We obviously have a lot of other events going on that we're sharing details about, but it should be back up soon, is that we do have a community training survey. So we welcome the community if there's any ideas you have, any requests for training that you would like to participate in and have not seen, there's a form that you can fill out for the survey, and that comes to us as well for us to consider and potentially offer in the future too. So here is our home page. And as I mentioned, I've circled some of the key information that you may be looking for from the home page. The top bar has our 24-hour access to call number. And there is a button that you can click on to the far left for Espanol. That obviously translates all the pages into Spanish for any of our Spanish-speaking members. In addition, on that top bar is the Find a Provider link. So you click on that, that'll take you to the online provider directory, and I'll show an example of what that looks like as well. And then in the center of the page, next to the Trillium logo, I've circled the For Providers and Families. That's where you'll find the bulk of the information that I shared too, that we reference in the new member letters and also the annual letters. That's where you'll need to go to find that information if needed.
Newsletters.
That's right. And also from the home page, I did add this in after printing off my original notes. This is where you'll go for the newsletter sign up. You can select it's the external or stakeholder newsletter, and anyone is welcome to sign up for that. And again, we do send it out quarterly, and that's just another vehicle for us to share information with the public, either upcoming events, key information from the state, new RFPs we may be releasing, all kinds of good information on there. So I do welcome anyone interested to sign up for that too. And this is what the cover of the Member and Family Handbook looks like. And again, it is linked from that for individuals and family page. But again, like any of our other information that's on here, you can call the call center to request a hard copy that can be mailed to you. And here's one of our social media pages. We actually have 3 accounts on Facebook. We have our general overall Trillium account. We have a separate page that is specifically for members and family members that have an IDD. That's our enrichment page. And that shares information in particular. Did not advance.
You're on the rights and responsibilities.
Oh, I'm so sorry.
That's okay.
Be helpful to turn the page over. Still have a little bit more to share on the website tour. So this is a copy of the member, the Notice of Privacy Practice and Rights and Responsibilities. This is mailed as a hard copy to every new member, and it's exactly what it mentions. It is your rights and your responsibilities, and also the appropriate phone numbers and contacts that you need to make if you do feel that any of your rights have been abused in any way. And in addition to that is a notice of the privacy practice. And as I talked about earlier, we are required to inform you and remind you about this once a year with the annual letters. Now, we do mail it out as a hard copy with the new member letter, and then we include in the letter that comes out annually after that you can either call Trillium for a copy or visit our website to do that. And here is the landing page for the provider directory once you click on that top right button from the home page. And we have recently enhanced this, so in addition to the text field that you see there where you can type in a specific provider's name or disability or specialty that you may be looking for, if you select the advanced options, you'll see it also has population served, specific specialties of what you're looking for. You can search by county and drill down to that level too. And just a few pointers that if you are using the text, we are working on a further enhancement that will have spell check. I know with a lot of the specialties and diagnoses and everything, that can definitely be tricky, but for now you do have to be sure to use the correct spelling. That will be an additional enhancement that we'll have soon for either predictive spellings, and when you start typing in the first few letters, it'll finish it for you, and also spell check too. So because of that, we did add those checkboxes too, to make it a little bit easier. When you see the term that you're looking for, you can select that as part of your search. Social media.
Yeah.
Yes, okay. Now we're on social media. So as I mentioned before, we do have 3 separate accounts, the primary Trillium business page, and we also have 2 separate pages for the different communities. We have one for enrichment for the family members or individuals with IDD, and then we have a separate page for recovery, so those with a mental health or substance use diagnosis. So with having those 2 specialized pages, we can share information that's more relevant to their needs, their interests, the types of events they may would be interested in attending, materials to review. And we have a few thousand members that follow us on all of those pages. We also have a Twitter account. So that's another way to get great information, not just from Trillium, but the other agencies and organizations that we work with. That in addition to information, it's also a great support mechanism. So sometimes, as we mentioned before, it can potentially feel isolating when you're going through some of these issues. So this is another great way through the social media to really see physically that there are other family members out there that are going through what you are and interested in what you are and everything else too. And this is, there is a link to our social media pages from the homepage of the Trillium website. You have to scroll down a little bit, but it'll link you to all of our accounts that we do have. So the communications and marketing team is comprised of 5 members, myself and 4 others.
Hang on, something's happening.
So I'll finish talking, David, if he's going to step up there and make sure we can get back online. The last page, we'll get back up there. It's myself and 4 other staff members that work on the communications team. I don't know if you've noticed, but Dawn is down here at the front. We are recording this presentation, and we will be sharing it on the page for the Columbus realignment after this event. And we'll also share the PowerPoints for this event. I understand we had not enough, or it's my fault, I did not print enough copies to bring here today. So anyone that did attend will be happy to email copies of these PowerPoints out to you, and those will be shared on the page in addition to the video itself when we get back in the office to do that. And on top of that, the final slide, when it gets up, does list our 2 email addresses that I talked about earlier, the info address that can be used at any time for general questions, and also the specific Columbus email address that can be used specifically for any Columbus questions.
Okay, so the network department is responsible for the maintenance of a quality provider network, as well as supporting the further development of the network to assure members' needs are met. We accomplish this by implementing our core functions of credentialing, technical assistance and support, routine types of auditing, and complaint investigations. Okay. All newly contracted Columbus County providers will need to go onto our learning portal, which is on our website, and complete the new provider orientation training, and then email us a copy of their certificate of completion to networkservicessupport@trilliumnc.org, and you'll have that email address at the very end of this presentation as well. For anyone that was currently contracted as a provider through Trillium, you actually have already gone through this course, or you should have had, and you would not have to go through this again. The network department, who are we? The network department consists of the director, the network services team, network auditing team, and 2 provider contract managers. Our department reports directly to the Vice President of Clinical Operations for Trillium, and network staff are located throughout the various offices in the northern, central, and southern regions. Credentialing and recredentialing. All providers, including agencies, clinicians associated with agencies, which we consider supplemental providers, LIPs and LIP groups, must go through the credentialing process upon approval to apply to our network. This process begins when the provider submits the appropriate application. The application is reviewed by someone on the network services team for 100% completeness. Any missing information in the application warrants the application being returned to the applicant. If the application is found to be 100% complete, the provider is notified that conduct checks will be performed. Primary source verification and conduct checks are conducted. If there are no hits, the application is considered clean and the provider is forwarded to the medical director for review. If there are hits, the application is actually red flagged and has to be reviewed by the credentialing committee for determination. If the medical director or the credentialing committee is considering denial of an applicant, they are notified via a pre-adverse action letter, giving them the opportunity to provide additional information to be considered. The provider or the applicant has 10 business days to respond, and their response or their lack of goes back to the credentialing committee for the final determination. The provider is notified within 10 business days of that determination. If and when the provider is approved by the medical director and/or committee, they are notified of the approval and the contract process is initiated or the supplemental provider is linked to that agency. All providers have to be re-credentialed every 3 years, and this is extremely important, but it is the provider's responsibility to keep track of their credentialing dates and to know when their re-credentialing is due. Technical assistance and support. The network department is responsible for technical assistance and support and customer services for and related to providers. This is handled through our network ticket system, which is managed by the network services team. Tickets may be submitted by other Trillium departments or providers needing assistance. The network department also facilitates communication and collaboration activities with and among providers, such as the provider directory, Trillium Provider Council, and network communication bulletins. So that's kind of where Jennifer was just speaking to. If you go on the website and subscribe to get our newsletters, you'll also receive our network communication bulletins. And we typically send those out every 2 to 3 weeks. They have information regarding anything that's coming down around service definition changes, things from the state, things that we're finding out in the managed care bulletins that we get from the state. So those are extremely helpful. You do want to apply to get on that mailing list. Network auditing and monitoring. The network department conducts several different types of monitoring and reviews of providers to ensure the best possible service delivery and business practices are being carried out within our network. These include initial site reviews, provider monitoring, UAFL reviews, monitoring of compliance with contract business requirements, complaint grievance investigations, and provider concerns. The initial site reviews are conducted for all new providers and/or sites. So those of you that are brand new Columbus County providers, we will have staff coming out. The review takes probably 20, maybe 30 minutes, and they're just doing a real quick walkthrough to make sure that you have business hours posted, things like that. And that is actually set forth by the state, and we utilize the DHHS tools, which are also found on the state's website in order to conduct those reviews. So prior to the contract, a prospective provider would receive an initial review utilizing the DHHS tool to assess the areas including the physical environment, compliance with confidentiality and HIPAA requirements, compliance with service availability and 24-hour coverage. And again, all new providers interested in providing any of the following services would also need to be in full compliance and pass the home and community-based service e-assessment prior to providing services if you provide the following services, which include Innovations Residential, Day Supports, Supported Employment, and B3 Supported Employment. If you've already done the HCBS assessment through East Point, we will be able to hopefully get a copy of that from the state, and we will be able to just transition that over to Trillium, so you won't have to worry about that. Provider monitoring. Provider monitoring is conducted with every fully contracted agency every 2 years at minimum, and this is a little bit different from East Point, but every 3 years with LIPs and LIP groups, utilizing tools and standards developed by the division to ensure compliance with general statutes, service definition requirements, clinical coverage policies, etc. The areas reviewed include but are not limited to clients' rights and confidentiality, QA/QI plans, personnel records, clinical service records, paid claims, policies and procedures, and incident reports. Providers who are accredited for 2 years or more receive a post-payment review only, and actions and follow-up activities, if applicable, from provider monitoring would include technical assistance, plans of correction, recoupments, paybacks, and those are based solely around the score and the severity of any issues that are identified during the monitoring reviews. The unlicensed alternative family living reviews, these are our health and safety reviews, and they're conducted on all of the UAFL homes. They utilize the DHHS review tool prior to placing members in the homes and annually thereafter. If deficiencies are found when reviewing a new home, corrections must be made before the home will be enrolled. When reviewing a home already in network, if deficiencies are cited, a second review is conducted no more than 30 days later to ensure corrections have been made. Upon the follow-up review, if there are still deficiencies, a full review will be scheduled to determine the next course of action. This time, an opportunity are given to the provider to correct the deficiencies because we want to ensure health and safety while hopefully preventing the disruption of an individual's residential placement. Complaint investigations and quality of care concerns.
Am I on one slide?
Provider monitoring.
Oh, we just went over this. So I'm not even caught up, is this the right one? Yeah. Okay.
All right, so the complaint investigations and the quality of care of the provider concerns. Our network auditing team also has staff dedicated to investigating the complaints and grievances. Most of these are handled through resolution requests by the providers, which means that the network auditor will contact the provider about the complaint made and request that they do an internal investigation, submit documentation, and report findings and results back to us. In certain cases, depending on the nature of the complaint or the concern, the network auditor may conduct the full investigation. In either case, the process is very time sensitive and must be conducted within time frames set forth by the state. Any actions taken will depend on the findings, but could result in anything from no further action, a plan of correction, financial claims recoupment, or possibly contract termination. So as a new provider coming into the Trillium network, some of the most basic things that you need to know to be the best provider possible are: first, communicate with us. Please send us any updates if and when there are changes in key personnel, contact information, office site building locations, NPI numbers, individual provider tax name or tax ID, service and clinical specialties, or when services or clinicians need to be deleted or disassociated from your contract, all of which can be handled through what we call a provider change form, and that is also under the provider section of the website under provider documents. The provider change form may be found under the provider documents section. So ask questions and utilize our network ticket system for guidance and support whenever you're unsure of anything. Please stay current with the communications that are relayed from Trillium and the division via our network communication bulletins, our clinical communication bulletins, our provider trainings, which we share important information related to service and administrative requirements, clinical coverage policies, training opportunities that are all critical to your operations as a provider. And finally, please know or at least have sufficient familiarity with the driving forces and the resources behind the services that you're providing. And this should be my last slide.
Okay.
It goes down.
Yep.
Okay. So here are the ways that you can contact the network department. There should be 3 email addresses up there.
And so, well, there's 2.
There's one additional one, which would be important for network monitoring. It is networkmonitoring@trilliumnc.org. And one of the things that we have changed within the last year around our provider monitoring is we are trying to get away from the on-site reviews so much and coming on and being intrusive. So we have moved towards more desk reviews. So you're going to find out that a lot of the provider monitoring that's going to take place whenever yours is due, you will get the notification. We give you 10 days to submit to us the documentation that's in that notification letter. And we ask that you submit it. You've got about 5 or 6 different variations of where you can submit it to, but you can do it through, for example, secure email. We have an FTP site set up that you can actually upload your documents to. You can scan it to secure fax. In some instances, we've even had providers actually ask if they just drop off the hard copies to our office, and that's fine too. And you'll actually have a lead for that review that will be in communication with you and work out all of those details. But again, we have tried to move away from those on-site reviews and move more towards the desk reviews. So before I move on and introduce the next or the last person, are there any questions?
I'm the Mobile Crisis Director with Integrated Family Services, and as Ashley shared, we will be your mobile crisis services provider for Columbus County. We have, as an agency, Integrated Family Services, been in partnership with Trillium Health Resources now for over 15 years. And with that partnership, we have provided mobile crisis management services for 12 years. And in those 12 years, we have expanded our services quite a bit, and those services have expanded from northeastern North Carolina to now we provide mobile crisis management services to the entire Trillium coverage area. So that is 25 counties currently that we provide mobile crisis management services, and we are excited and look forward to providing our services to Columbus County on July 1st. This slide that is on that is up now is a copy of our mobile crisis management RAP card. This card is a marketing tool and educational tool. That we use to share information about mobile crisis management. This is a service that is available 24/7, 365. Very similar to first responder services such as EMS, we respond to mental health, substance use, and intellectual and developmental disability crisis situations in the community. So we respond to crisis situations, and just a couple of examples can include if an individual is experiencing suicidal ideations, they can contact us. If they are experiencing symptoms related to psychosis, if they are intoxicated and they are in need of assistance with linking with a detoxification facility, our mobile crisis management services can respond to that individual in the community. Our service definition, not written by Trillium Health Resources, but that we abide by through the state of North Carolina, allows us up to 2 hours to link with an individual to assist them through a crisis situation. We are excited that within Columbus County, we actually have a team member who resides here Grant Gauls is our team member for Mobile Crisis Management Services and is excited to serve his hometown. He's excited to serve the community here. Through Mobile Crisis, our goal is to keep individuals out of the emergency department and avoid unnecessary hospitalizations. We do recognize that individuals facing behavioral health crisis situations sometimes do need a hospital stay to ensure their safety, but oftentimes they do not. Most often, in our experience, they do not. And providing services, again, for the past 12 years, we've noted that we are able to keep 70% of the individuals we respond to in their communities. That means that 70% of the individuals are linked with behavioral health resources, they're linked with outpatient therapy, they're linked with SAOP, they're linked with community services to help them to avoid future crises from occurring. With our partnership with Trillium Health Resources, you are able to contact us directly. Trillium is great, Ashley and her call center staff are great, but part of our relationship is that we want to cut out the middleman and get straight to crisis response. And that is a great relationship that we have, and that again has been a part of our working relationship over the past 15 years. I want to share with you a brief video, I'm hoping that this works, that just briefly talks a little bit about our services that we provide with our mobile crisis services, just as with Trillium Health Resources covering more counties than any other LME MCO in the state. That is the same for our mobile crisis management team. And we want to make sure that individuals have a brief visual of what does it look like when you call and request for services for yourself or for a loved one. Pretty much we agreed or we decided to provide this service because we felt that no matter what we were doing in providing education to the community about suicide awareness, we were still losing youth and adolescents as a result of suicides. With our online emotional support, there's no consent needed, there's no permission. Individuals can simply go onto our website and access this service. They will go through a brief registration process where they're asked of their name, but they can chat with us anonymously. And the chat specialists on our end are qualified professionals or licensed professionals. But Crisis Chat, we make sure that it is shared that this does not replace a clinical relationship. If an individual has a clinical service or has a therapist, we want them to continue with that relationship. But this is just that if it's 2 o'clock in the morning and someone is not doing well and they feel like they need some additional support, we're here to be able to provide that support. The PowerPoint showed a copy of our posters. We want to make sure that Columbus County schools are saturated with Crisis Chat posters. Is anyone here from the schools today? Okay, so we want to make sure that at the beginning of the year that we are saturating the schools with those posters because again, youth and adolescents are our targeted audience, but that service is available to anyone. In addition to the posters, we have cards that are this small, wallet size, where the hope and the design of this card is that it could easily be slipped into someone's locker, or a teacher or counselor could provide it to a student in a way that no one didn't know really what was going on, but they could provide this to them and they could slip it in their backpack, their purse, their back pocket, and then they're able to access this later. We have partnered with some of the local schools in that they have provided our Crisis Chat information onto their school district website. That is something that we hope to be able to partner with Columbus County to assist us with doing as well.